Today, some alarming facts about South Asians and heart disease.
Early morning, 3 a.m., I had the heart attack. I said, it's not heart attack. I had 9 out of 10 symptoms. It's not heart attack. And finally, I called my doctor. And he said, Praveen, you're an idiot with a PhD degree. You need to run to the hospital right away and take care of yourself. I drove to the hospital. I walked to the nurse's station. And that's where I collapsed.
We were surprised to see young, healthy-looking, non-obese, slender, exercising, vegetarian, 44-year-old engineers presenting to the emergency room with heart attacks without any of the classical risk factors for coronary artery disease.
Welcome to Chai with Manjula. If you are of South Asian descent, our show should be of great interest to you. Studies prove that South Asians are at a much higher risk of developing heart disease at a much younger age and with greater intensity compared to the general population. But the good news is that heart disease is preventable and treatable. Today we'll introduce you to the only heart center of its kind in the world that offers advanced screening, free clinical and nutrition consultations, and heart health coaching to South Asians. This center empowers its participants to detect and manage risks and their physicians to effectively treat the disease. It is the South Asian Heart Center, a non-profit establishment here in the San Francisco Bay Area. And to tell us all about it, Ashish Mathur is here. He's the co-founder and executive director of the center. Ashish, good to see you.
Thank you. Thank you for having me here, Manjula.
You're welcome. This is really scary news for South Asians. How long ago was it established that they are much more susceptible to heart disease? And how serious is the problem?
Well, Manjula, as you know, there is an epidemic of heart disease in the South Asian community. South Asians are people from India, Pakistan, Bangladesh, Sri Lanka, and Nepal, essentially the Indian subcontinent.
I see.
But there have been several studies that have been going on worldwide regarding this issue for almost 20 years now.
I see.
And this problem is not new. It's been there for a while, and many studies have shown this increased risk. There have been studies in India, of course. There have been studies in London, Singapore, and the United States. And when consolidated together, the South Asians end up having 4 times the risk for heart disease compared to other populations.
Oh, I see. And I also heard that they get it at a much younger age with much more intensity. Can you tell us about that?
Sure.
Some of the statistics, if you could
Right.
give us that.
In the United States, for example, the average age for the first heart attack is 65.8 years for men and 70.4 years for women. This is on the American Heart Association side. What we are seeing in South Asians is that 50% of the heart attacks occur before the age of 50 and 25% before the age of 40. So we can see that, this is a very highly progressive disease in South Asians, claiming many more lives. As a matter of fact, it has twice the rate of mortality compared to other populations, and 3 times as much risk for a second heart attack if you're lucky to have survived the first one. So all in all, we feel that this is a very malignant and progressive disease, and it's an epidemic of epidemic portions that we need to control and start addressing now.
And what about women? Are they also equally at risk?
Women are at as much risk as men in this population. Premenopausal women, those who are actually safer during their premenopausal years, in other populations don't have heart disease until this later age, whereas we are seeing premenopausal women having heart disease in South Asians. In California, for example, 30%, the South Asian women mortality rate is higher by 30% compared to other populations. And it's a myth in our community that that men have heart disease and women don't.
Right.
So we at the center, of course, encourage women to join in with their spouses when they sign their spouses up for a screening.
Yeah, these are staggering numbers, and it's surprising that Indians have such a high risk of heart disease because many of them are vegetarians and they don't drink or smoke as much. Obesity is not that big of a problem. So what is the reason?
Well, at the heart of the issue are really two things. One is, of course, the genetic kind of makeup that you have, and the second thing is the lifestyle. And at the center, we say that the genes load the gun and the lifestyle pulls the trigger.
I see.
And so what is different in South Asians, you might ask?
Right.
So we know that some landmark studies that are out there, like InterHeart, talk about the 9 risk factors that explain 90% of the heart disease. All those risk factors are present in South Asians as well, but are prevalent in South Asians at younger ages.
I see.
Some studies have pointed to 2 or 3 metabolic risk factors that are genetically determined that have a higher predictive value in South Asians.
Okay.
Those are some of the things that we test for at the center as well.
Okay.
Now, obviously, there's got to be a lot more research in this particular area to zoom in on exactly what the genetic mutations are that are causing this issue. And InterHeart would say and would say that if you focus on the lifestyle, there are 5 behavioral risk factors that you can address that can be very effective at preventing heart disease.
That's the good news here.
Exactly. These 5 behavioral risk factors are not smoking, exercising regularly, eating vegetables and fruits, managing your abdominal obesity, and managing your psychosocial stress.
I see. Tell us, how do you go about identifying high-risk cases, and how do you manage them, and the costs and everything?
Sure.
How, is it free, or do they have to pay a little bit if they come for testing?
Exactly. Okay. So the South Asian Heart Center's mission is to prevent heart disease among South Asians with a culturally sensitive program that incorporates advanced screening, education, and then heart health coaching. And I'll kind of explain, what all of that means. So the first step for anybody is to kind of go to our website and sign up for a screening. This screening has kind of 3 components to it. The first one is what we call the heart health risk assessment. The second one is a laboratory test, which is an advanced test. And then the third one is a physical exam.
I see.
We call that the assessment portion of our methodology. And there are 3 parts to that methodology. The second part is identifying, as you mentioned, who are the high-risk cases. So what we look at is consolidate these results together, and we create a report for a participant that identifies their risk factors in the order that we feel is important, that they can work on and address. There are some that you can't change, like your age or your gender, etc., or your family history. But what you can change are things that can change the metabolic profile that you have. And so we highlight those and then create a plan to manage those. So assessment, identification of your risks, and then the management. We call it the AIM methodology, AIM. So we do that first set of assessments, which is what you go through. There's a heart health risk assessment, a laboratory test, the advanced screening, and a physical exam.
Are these free?
The only component that is not free out of pocket for you is the laboratory test. The laboratory test is done by an outside vendor, and they charge you insurance, and then whatever is not covered by the insurance, they will charge to you. We have set it up so that the maximum out-of-pocket expense for anybody doing that advanced test is $73.
That's very reasonable. So $73.
And that's it.
For the lab test, maximum.
Yeah, and that's paid directly to the lab. So the South Asian Heart Center really doesn't charge for any of its services.
So all your services are free.
Exactly.
Okay. All right.
Now the management is 2 parts. One is the medical management. The center does not do that.
Okay.
We work closely with your physician who will monitor the medications that you need to better your profile. We focus on the lifestyle management, and in that way we kind of form this collaborative environment between the participant, the physician, and the center. So once that laboratory test and the physical exam and the assessment is done, the phone interview is done, after that there is a nutrition appointment. So we have a South Asian nutritionist who works with you through a series of consultations. So it may not just be one consultation, but multiple consultations. Typically it would be 2 or 3, where you would go through what you eat. And the intent of that is to make slow changes to that, both with what you eat and what's in your pantry, so that you can make sustainable changes to your eating habits going forward. And that can make a dramatic difference, to your risk profile. So we really focus on the nutrition aspect. And it's followed by what we call heart health coaching. That service, again, is provided at no cost to you. Heart health coaching is when you have a personal trainer, heart trainer, for you at the center. It's very hard to make lifestyle changes. And what we have seen, and through studies that actually have been done for diabetic patients, etc., is that when they have an associated coach, or what they call case manager, who is responsible to a individual participant and tracks the progress that the participant is making. Very often you don't make progress. Very often you take a step backwards. If there's nobody to kind of talk to you about that, the chance that you will ever make a change is very little. But if somebody is right there who comes in and says, were you able to walk 3 days a week like we had asked you to, and they say, no, we weren't able to do because my child was sick, or I had a knee problem, or I was traveling, then our coach will be telling you what to do while all of these situations occur. What to do when your child is sick, or what to do when you are so busy during the day that you can't find time. We will help you find those 5 minutes, 10 minutes that you need in between things that you do. And we kind of look at that. So it's a very personalized kind of coaching, and a way to help you make those sustainable changes that you want. So for stress management specifically, we work closely with transcendental meditation and type A behavior change, because these two have the largest amount of evidence in terms of heart disease risk reduction.
How many people would you say have been tested, and how many came out positive? What percentage?
That's a very interesting question. So far, over a 3.5-year period, we actually started the doors of the center in 2006. Mid-June of 2006. And since then, we have screened almost 3,000 people. The biggest issue that we have seen within this population, and almost 80% of the people that have come in exhibit one or more risk factors. Out of which, if you look at the two things that are very, very common, hypertension and diabetes, both risk factors for heart disease as well, is very often they find out about that for the very first time at the center. Because either we have screened them earlier than their physician would have, or that they didn't take it as seriously before and just let it go. There are several situations when we are actually talking to them on the phone and doing our first interview, that we actually stop the interview and we just tell them to dial 911 and go, because they have signed up on the center while they are having chest pain, and that's not when you should be. Our center is focused on prevention. Not on addressing your first heart attack, which might be happening, especially if you are having symptoms. On that note, actually, I might want to add that the symptoms of heart disease are so varied that it's actually very hard to identify it. The typical symptoms that people talk about, which is pain in the chest, real solid pain in the chest, or pain that goes through the arms or in your jaw. Typically happens in men, number one, and you may not even have that. What you may have is like a feeling of indigestion, and that may be the trigger and the starting point for that. And to those people, I would say that the thing to test for and to actually be very quick about calling 911, even if it is an indigestion, especially if you are 40 and over, is to see if the pain that you might be having becomes more or less when you press on it. So if you press on your chest area and the pain becomes more, then it's typically like a muscular thing, and it may be because of the indigestion, etc., that you'll start feeling that. But if it's a heart attack or chest pains because of coronary artery disease, the pain is going to be constant. It's not going to go up or down with pressing different parts of your body. So that's one thing. And then women have a different set of symptoms, or they may not have symptoms. Their symptoms may be like flu-like symptoms. They might feel very fatigued. They may have body aches and pains, like are there with flu, and they are the ones that are being sustained. In those cases, I mean, don't wait to come to the center. Just dial the 911 and kind of get help right away. It's just that it's very hard, and sometimes people are in denial. I mean, I was. When it happened, I actually spent almost 15 minutes at home, or more, maybe, as my pain started. And those are valuable moments. Those are valuable minutes where you may prevent the damage that's caused by a heart attack if you get to it early. For me, there is damage, and I have to deal with it and all the repercussions and the side effects of that throughout my life. But others, who take the action early may not. And the earliest action to me actually is to sign up at the South Asian Heart Center even before you're having the symptoms.
Ashish, now tell us, how successful has the center been in its mission? And what are some of the challenges, if you can tell us about that?
To me, the greatest success for the center, number one, is the increased awareness of the issue of heart disease within our community. I'm not quite there yet in terms of, if you ask anybody on the street whether they know about the center or the issue, they may not.
Yeah, people still need to learn about it.
But I think that the large amount of people that have come to the center to get screened is in itself a big success. The second big success that I feel is that 60% of the people who come to the center get connected to us and with our heart health coaches. So I know that they are focused and motivated on making a change. Now, 60% is a very, very large number. In any case management program that's out there, getting 30% compliance is hard. But just getting 60% of the people to say, yes, we will respond to you and to give you updates on what we are doing is a big thing. And everybody is so busy, so we feel that is a great success. 10% of the people that we've been able to say that they have diabetes or impaired blood sugar levels, which they didn't know about, which could cause a lot of issues for them later on. And almost 23% of the people that have come in that we have told that they have hypertension and that they need to address their blood pressure. So if you look at the other statistics regarding the actual metabolic profile, you'll be kind of surprised, because 70% of those will have 2 or more risk factors, which they didn't know about. And so to me, that is a success. And at the end of the day, the greatest success is in knowing that some participant who walked in through the doors of the center today just saved their lives.
Right. Now you are offering all these services free. How do you get funding?
Oh, that's an excellent question, yes. Especially in the Bay Area, you kind of worry about, a startup and how do they get funding, etc. And I consider this a startup. We were very fortunate to have a backer, a venture backer. In this case was El Camino Hospital. And so they gave us the entire seed money to start it off. As well as all the services that you need in a clinical and hospital setting that we got. Space within the hospital, all the IT and infrastructure set up, etc. And the staff to kind of, run the clinic and the center. So that's how we started. We also were lucky and fortunate to get large donations from some of the community members who were aware of this issue, were participating with us in the founding of this center, and who pledged for multiple years to provide funding for the center. So now the funding sources are, El Camino Hospital on an ongoing basis. They have over the last 2 years provided more than 50% of our funding.
Okay.
The community donors. We do gala events and other events to seek donations from the community. And then we write grants, and we seek corporate funding through grant writing and sponsorships as well.
So what will be your message for our viewers?
I think the very first message is that if you're hearing this, don't delay. Make sure that you get yourself screened. You do not actually have to come to the center. All you have to do is set up an appointment with your primary care physician to get the process started. You may have never had a cholesterol test. Get that going with your primary care physician. The primary care physician many times works collaboratively with us. They might already refer you to us. Get our advanced screening done. It has a higher predictive value for risk factors compared to the traditional guidelines that are there in this country today. So, and then ours is also a very comprehensive program. So if you get screened with us, you get all of what we talked about at no cost to you. And then once you're done with yourself, get every single family member who is 18 or above to come to the center or get them screened. Whether they are here in the Bay Area, whether they are anywhere in the United States, let them know they can avail of our services here from where they are at. They don't have to visit the center. They can go online and start their process. And we can do all the consultations over the phone. And then the other message is that 60% of the heart disease burden is going to be borne by South Asians, which is less than 20% of the world population. And this is a WHO study that did that. And it is the /1 killer. Above infectious diseases that happen in South Asia, above HIV, AIDS, all of those things. And so this is a true cause to donate as well. And I would urge our viewers and our community members to look at nonprofits like us who are focusing on heart disease as a place that they could contribute and provide funding for. One of the strategic initiatives of the center is to collaborate with physicians and educate them on this issue. You'll be surprised at how many primary care physicians in this country do not know of this increased risk in South Asians. So when, as a South Asian, you enter their offices, they will take you through the same assessments that is there for everybody and the traditional guidelines, which underestimate the risk. So our hope is that we can get this message out to all physicians and that they do something special in their practices. First of all, as soon as somebody turns 18, to get their cholesterol testing completed, which is typically not done in this country until you're 45 years of age. So you have, and by the time you'll be dead, I mean, if you have this disease and you're not doing something about it. So that's #1, is to kind of get their testing going at age 18. And being very aggressive about the cholesterol numbers. Working really hard on getting the HDL of these people up, which means that focusing on exercise. HDL really responds to exercise. It is hard, but at the age of 18, I mean, if you motivate somebody to exercise, that could be something that they could carry through the rest of their lives. So that's my message for physicians. We run seminars all the time for physicians, and we also encourage them to go to our website and join in and register with us as a physician so that we can invite them to our education sessions.
Well, Ashish, on that note, I thank you very much for coming by. It's a great initiative and has a potential of saving millions of lives. I wish you all the best.
Thank you for having me here, Manjula.
Medical research has shown that there is an epidemic of heart disease among people from Bangladesh, India, Nepal, Pakistan, and Sri Lanka. These people are 4 times more likely to suffer from heart attacks. In fact, the World Health Organization estimates that by 2010, about 60% of the world's heart disease will be borne by Indians of South Asian descent. The South Asian Heart Center has developed an innovative and highly effective process for identifying and managing the risk factors among program participants. At the initial meeting with the participant, the center conducts a detailed heart health risk assessment, an inventory of 60 questions covering demographics, family history, and lifestyle. It then conducts a brief physical exam and requests an advanced blood test covering the emerging advanced markers for heart disease. Because of the advanced testing, the center develops what it calls the 4 R's, a custom program for its participants. The first R is the risk report that begins by identifying and prioritizing the risk factors in order of the key risks for heart disease. The recommendations, the second R, are tailored to the participant's specific risk profile. The third R is for referrals to wellness resources in the community. Finally, the fourth R is for rechecks, or periodic phone calls, as case managers work with participants to motivate them and ensure that they succeed with their new program.
When we discuss diet or exercise, we have to tailor an exercise program for someone who's working 70 hours a week.
I don't think I would have made on a consistent basis the changes that I'm making currently if not for somebody calling me up once in a while and following up.
I give them dietary recommendations, and they completely agree with me that it's very important for them to make those changes. If I don't follow up with them, I don't know if they're actually able to make those changes that they had promised they'll make.
They were not giving me a canned version of something that was a book that applied to everyone. It really was tailored to my personal style and, of course, broadly speaking, to the South Asian community.
The family aspect of what they did included the screening of how we live our life, who are in our household, what kind of foods we eat, what kind of snacks we take part in, what kind of stressors I have in my life, as well as the fact that they then said, well, your wife needs to come in to get tested as well.
They realized that it's a family situation. When you have to change your lifestyle, it's not just one person. It has to be the whole unit.
We also want to educate the physicians in the community so that they become aware of the increased risk of cardiovascular disease in this population, so that they themselves can actually start screening individuals, and every physician's office then becomes a mini South Asian Heart Center.
A program that's this ambitious, and it is an extremely ambitious program, cannot exist without community support. And we've been extremely gratified with the support that we've received so far.
There's a tremendous amount of goodwill that's been spread about the South Asian Heart Center, person to person, through social groups, through temples, through community organizations.
The benefits that the Heart Center is going to deliver are going to have such far-reaching impact.
I really encourage you to come in and get screened, volunteer for the center, and donate. I think it'll impact your life forever.
Well, that's all we have for you today. We featured South Asian Heart Center in the San Francisco Bay Area, the only center of its kind in the world with a mission to reduce the high incidence of coronary artery disease among South Asians through a comprehensive, culturally appropriate program incorporating education, advanced screening, lifestyle changes, and case management. They invite South Asians to get tested and to take advantage of their services. All services are free except for one lab test. For more information, you may look them up at southasianheartcenter.org. And you may watch our shows, including this one, at chaivithmanjula.org. Thank you for watching. For Chai with Manjula, I'm Manjula Gupta. See you next time.